Hi, I'm going to explain the Hutchinson-Gilford Progeria. The continuance is introduction and diagnostic. The diagnosis is progressive genetic disorder that causes premature aging of the children. The continuance is the general description on this case.
Hutchinson-Gilford Progeria. The diagnostic is progressive genetic disorders that causes premature aging of the children because it's the different of the other children's. For the example, their lyrics is complicated, but is general description of the disease. The progeria, also I note as the Hutchinson-Gilford syndrome, is a extremely rare progressive genetic disorder that accelerates the decline of the children and begins in the first 2 years of life. The children with progeria often appear normal when they are born during the first years. Six symptoms begin to the upper such as sore throat and hair loss, hair problems and strokes and hair loss. Hair problems for the strokes are the final causes for death for most children with progeria. The adverse life expectancy for children with progeria is the 20 years, somewhat may. There is not cure for progeria, but ongoing research knows some hopes of treatments. The symptoms. The first symptoms for the progeria is the stunted growth below the birth height and weight, narrow face, small lower, hiding lips on Achilles nose, head, the proportionality large of the face, prominent aids and incomplete eye colors, hair loss excluding injections and eyebrows, and the think plugins is a prickly skin, visual pains, and acute voices. It severely progresses the size of the hair and the both bases cardiovascular, hardening of the strength of the skin of the trunk of limbs similar on the cloderma, sonadrin of hearing loss after the unders in the skin of black muscle mass. Causes. The causes is single genetic mutations is responsible for progeria. The gen I not in laminate egg because protein needs to hold the centers. With these genes and detect defect and mutations, but at normal front of the protein laminate egg. Cal's progenesis produces take make cellulite on the stops. In the most case, the gene's mutations is unusual for the fortitudes. Treatment. The treatment depends on the case. There is not cure for progeria, but medications can end symptoms of the slow processions. Therapeutics, occupations, therapy of physical, and another therapeutic. Medicines. The medicines is stained, non-steroidal, anti-inflammatory, bone heal bites, and hearing aid. The technical purposes to take two techniques for treatment of diagnostic. The treatment is a CRISPR-Cas9 and anti-sex therapeutic. And the CRISPR-Cas9 is a functional targeting DNA and the cord band of gene mutations in RNA on the Cas9. And the anti-sex therapeutic is the only oligonucleotide antisensitive for the mutations. Descriptions of the methodology. The CRISPR-Cas9 will be used since the method of it is a modifies the lamina genes to that avoids the production of the toxic protein and the use avoid the expression for the mutations of this abnormal. The CRISPR-Cas9 for the treatment of the Hutchinson-Gilford Progeria. This treatment is the use determines certain patients with the T size of the use the type of therapeutic. They see how the patient is improving. When the results have been obtained for H patients, modify the genes to be injected into the cells and the use be able to use the technique for the genetic mutations. Um, the other technique is anti-sex therapy. In a oligonucleotide decides to be a complementary part of the certains in mRNA is going to be used in order to avoid the expression for a corresponding protein and within the activity of the genes involvement. And those oligonucleotides contain the complementary sequence its use the avoid contain the muted RNA that produce the protein that is what causes the Hutchinson-Gilford Progeria syndrome, and they thus avoid the production of the mutated protein. Advantages and the disadvantages of the techniques. The first is the CRISPR-Cas9. Advanced hence is a therapeutic that will help the hens not be esconded. This treatment will prevent the mutation or more cells with the anomaly from spreading. The disease is treatment use not assurance to the be effective in the clinical study, and the patients are not guaranteed wherever their disease will stop. For example, is the it's not it I used to be effective in the progeria. In the antitherapeutic advantage, is the treatment is designed to be a complementary part of the certain area in order to prevent cancer cells from spreading. This anticipate therapeutic will hit a regulation for H patients, and the take will be flowing up of the treatment depending on the doctor does. The disadvantage is treatment is not sure that an approved in a warranted signs. These patients are minors and they cannot resist so much. Treatment is not guaranteed to be accurate for the disease. The selection criteria. The techniques were used to avoid the expression for the mutations is anomaly, with the CRISPR-Cas9 of the treatment of the Hutchinson-Gilford Progeria. This treatment is not determined in patients with the disease of and I use the type of therapy to see how the patient is provenance. With that anti-site therapy is designed to the big complementary part for the centers in area in order to prevent cancer cell from spreading. The disease techniques will take use to the next level. So, in the clinical studies given in a possible answer, this will be a big change of every patient. That conclusions. These treatments will take use stop at the medical or biological level. It will be used for each of the patient. The clinical trials will have the province by the FDA so that these therapeutics can be used with under genes mutation in another disease. In Latin America, the degree for progeria is a terrible disease for children. Would suffering from its own I focus on the disease techniques to the treatment these disease. The reference.